So I just wanted to go over a couple quick tips with Whiteboard. I did go over most of the codes. There are a couple other ones that I would like for you to know. There's the monitor for code, and for this case it would be monitor for diarrhea, but it also could be used for many other things like respiratory rate, seizures, anything that might pertain to the pet that you'd want to make sure treatment room nurses and other nurses always look out for. So if you search that, it'll be right here, and then you'll put what it is up here. So for this patient, I'd do diarrhea. There is another code that's really important to know. It's miscellaneous treatments. It's important to know this one because if there's ever anything you need to schedule through Whiteboard that doesn't have a code associated with it, that's when you're going to use this one. Because remember, like I said from before, a code must be there in order for us to properly put it into the record and have F5 notes associated with it, and to make sure it doesn't show up on the client's invoice. So I'm going to go here and I'm going to search miscellaneous, and you'll see two options down here. Never ever pick this one right here. This one's for doctors if they were to be doing a treatment that we don't have in the hospital and they want to charge a certain price for it and it's just not something we currently have. Always pick the one with the hospital associated with it, because if you pick this one, it will show up on their invoice and we don't want that. So that's when you'd pick this one and you'd put whatever it is. Say a patient was here for a declaw and in the morning we're going to do their laser therapy, and that's where I can put that. I'll put TLT post declaw, and then I'll schedule that for tomorrow morning. So that's just another quick tip. Or you can do hydrotherapy, cryotherapy, anything like that with this miscellaneous treatment code. The last one I would like for you to know is our observation code. And this one you can also put straight here through your description in Avamark. You can just post it like a normal line item. You don't have to go through Whiteboard, so I'll actually show you that way. This is going to be used anytime a patient might have a seizure, they might have vomited, anything like that that you need to note in their record so that everyone else knows that it happened too. So I'm going to do observation notes, and then I'm going to put what it is. So good dog had diarrhea. I'm going to post that to the record, and then like I said, every single time we're going to want to update our F5 notes. So that's when I'm doing my time date stamp again, and then I'm going to say what I saw. Patient had diarrhea all over a kennel, and then I might want to put what score it is. And now if we were to look back to the record, if a client was to call in, this would let CCS or anyone else know that yes, that did happen and what time it was at. You always want to do this in real time, and just remember, we always want to post everything in real time as well. So as soon as you finish with the treatment, that's when you're going to post to your record. I'm not going to post yet because there's a couple other things I do want to talk about with some more quick tips for you. So say you accidentally put a treatment in wrong, or the treatment was to change and we no longer need to do it. A lot of people are getting a little bit frustrated because you have to go through and manually delete every single one. But remember, these tabs up here are your friend. So let's say for some reason Dr. Ryan, the dog was having an adverse reaction to the Metro and we want to get rid of it. So what I can do is actually keep the patient, I'll take my start one down, and I might put up code instead. And then I'll see all the different options for good, well, that's for Curry, but for good dog right here, and I can open up meds 1, and then I can delete all of these at once. So I can actually highlight it, I'll press shift and go all the way to the bottom, or if I need to do separate ones, I could hit control and do just the ones I needed. For this patient, I can just delete it all. So sorry, I'll shift all the way to the bottom, and then I'll hit F4 or right click and hit remove. And just know if you do click this, it's going to delete them all at once. So make sure you do want to do it. So I'm going to hit yes, and it's going to delete all of those codes for the meds 1 right there. So that's just an easy way to do it instead of going through the record and trying doing each one at a time. Another good tip is in the mornings, say if you're treatment room nurse and you want to see what to do, you can actually go by time. You can pull it up, and it's almost 11 o'clock right now. Looks like there's nothing due at 11, so I'll see what's due at 12. And now I can see everything I'm expected to do at 12 a.m., and I can go by each time and kind of have my treatments and everything else I need to do as a treatment room nurse kind of planned out based on this. Okay, let's see. That's kind of the main things for our quick tips. Another thing to know is that there is an error board that's actually in the pharmacy right by room 2 and behind the computer in surgery prep, behind like the surgery board. So if you do find that you do have some sort of error where it's not posting correctly, or anything like that, that it's the injection price is wrong, something like that, please always make sure you mark it on there so we can kind of keep track of this, so we can try and find if there's any patterns involved and if we can stop it. The only other thing I really wanted you guys to know is that if you go to your actual Q&A, I did put all the codes and everything that I'm talking about right now in there under Whiteboard, so you can actually open these up and they'll tell you what to do and what codes and everything I'm expecting from each one, as well as when to charge and posting and everything like that. So make sure if you have any questions, you can always come look in here, and that might tell you everything before going and asking someone yourself. Okay?